Hello, I'm Secretary of State Kris Warner, and I serve as the Chief Business Officer for the state of West Virginia. Part of my responsibility is to make sure that West Virginia is positioned to help create a strong pro-business environment to help grow our state's economy. To do that, my office is working to promote the services and programs available throughout the state to help support entrepreneurs and small business owners. This is part of a video series we call Just 3 Questions. These videos are a series of short interviews that I will conduct with West Virginia business leaders and entrepreneurs. Joining me today for Just 3 Questions is Dr. Clay Marsh. Dr. Marsh serves as the Chancellor and Executive Dean for Health Sciences at West Virginia University, where he oversees the university's 5 health science schools and leads efforts to advance healthcare education, research, and clinical care across the state. Dr. Marsh, thank you for joining us today.
Thank you, Mr. Secretary. It's great to be with you.
Thanks. You've dedicated your career to helping individuals achieve better health and building innovative ecosystems that make it easier for people to thrive. I also know that when you're facing a cancer patient that comes to you and tells you that the military hasn't done anything for 3 months, and then they told him that he wouldn't be able to have kids again, that you put together a team with an oncologist, a surgeon, a radiologist that took that as a challenge to say they wanted to make sure this guy still has children in the future if that's what he chooses. So not only does my son Kris Jr., who's here with us today, thank you for that, but my 4th granddaughter Abigail really thanks you for that. So thank you very much. Since joining WVU in 2015, you've been instrumental in recruiting more than 1,500 physicians, scientists, and researchers to serve West Virginia communities. Are you still recruiting, and what message do you share with candidates about the benefits of coming to live and work here in the Mountain State?
Well, we're still recruiting and we're still growing. You know, we're now at the university plus the health system. We employ well over 40,000 people, and we continue to spread across the entire state so that we can provide access to care for every person in West Virginia. And it's been really exciting and really important in coming back to West Virginia for me about 11 years ago, and Gordon Gee recruited me back, and Albert Wright, who was the CEO of Ruby Hospital, has become the president of our health system. And between us and the vision to try to grow a true academic medical center for the state of West Virginia has, I think, been realized. And with that, it really means that nobody has to leave the state to get the health care they need, just as you said with your son. Right. And there's nothing more privileged than serving those that serve, and also serving the people that serve the state of West Virginia. So when we bring people in, you know, first of all, people are amazed by the beauty of the state. And then they're quickly amazed by the beauty of the people and this mentality that no matter how much we have, we always share. Yeah. And that welcoming mentality has been really important. But not only have those features attracted physicians and scientists and really talented people to West Virginia, but it is also the ability to create an environment in which we can test new ideas. We have 15 different studies that are currently accumulating patients that are first in world studies. So we do our research solving real problems of real people, like Dr. Ali Rezai is doing with trying to reset the brain with ultrasound treatment so that people with recalcitrant addictions don't feel the need to use anymore. Or Dr. Vinay Babwar, who is the president right now of the largest group of heart and lung surgeons in the world who's championed many new robotic heart procedures using just a robot and minimally invasive techniques to be able to repair people's heart valves, not replace them, but repair them. And people come from all over the world for the treatment we have. So not only are we a great place to be, we're a very sophisticated place that is really pushing the envelope of medicine of the future.
It's great news, sir. The cost of health insurance is a real concern and challenge for business owners, regardless of the size of the company. How can business owners and employees alike reduce rising healthcare costs and still improve healthcare outcomes?
I think there's really only one way to meet the goals that you just set, and that is to have a healthier population. And when we start to look at the health of the population, as I said, we're very proud of the progress that we've made in West Virginia. And of course, West Virginia University, WVU Medicine, our academic healthcare system, but also Marshall Health and Vandalia Health. We can offer people now the state-of-the-art treatments so they don't have to leave West Virginia. But with that said, we still have some of the worst health metrics in the country. And as we start to think about the future to me looks like a comeback story of Phoenix Rising, where West Virginia starts to discover the way to start to bend the healthcare curve, not by coming up with different ways to monitor the spending of money, but to try to help the population be healthier. And first of all, that really revolves around great education to great job. Because the things that make us healthy and make us happy and help us live a long time are things like the strength of your relationships, are the purpose that you get up with every day. It's your mindset, whether you feel like you're so grateful and you're so lucky and everything is at your disposal, or you think like everything's a prison sentence and you're a victim and that everything's terrible. And we also know that movement's good, exercise really good. As little as 2,300 steps a day will help you reduce your risk of Alzheimer's disease and heart disease. And over 7,000 steps a day will get you the maximal benefit. Eating, we know that eating ultra-processed foods are not good for you and plays a huge role in our obesity epidemic in our state as well as our country. And sleeping, and it's not how much you sleep, it appears, it's how consistently you sleep. So on the weekends, you shouldn't try to catch up. You should sleep about the same amount every day. But having a great purpose, having great connections, feeling valued, feeling that the world is a grand adventure versus a prison sentence will help you live long and help you live well. And that will indeed reduce the insurance costs that everybody will have to bear.
So we're going to make this 3.5 questions because I gotta go do a quick follow-up.
Please.
So at our age, it seems like we're sleeping less. How many hours a night do we need to sleep?
Yeah, so sleeping is a really interesting phenomenon because nobody, even though we know that people will not be able to live if they don't sleep after 2 days or 3 days, it's so foundational, but we don't know exactly why we have to sleep, which is kind of ironic. Because if you think back during the evolutionary times, then, as you sleep, you can't defend yourself. So it seems like it wouldn't be that beneficial from a survival standpoint, but it really is. It's been shown in a number of studies that different people have different natural body rhythms. And there's something called circadian biology, which is we have clocks in our brains that actually respond to certain light signals that then either secrete more melatonin to make us sleep, not melanin, but melatonin to make us sleep. And then the melatonin goes down when the light comes on. And, now everybody's with their device and in bed, and we know blue light doesn't do good things for you. So you shouldn't take your phone or your iPad or your tablet to bed with you. It should be nice and dark. But probably 6 hours is around the time that is the minimum to sleep, and about maybe 8 hours, 8.5 hours for some people is the sort of the spread. But again, it appears that the consistency you sleep with is more important than the actual amount you sleep with, at least as far as studies looking at, health and health complications of not sleeping, which can include high blood pressure, heart disease, heart failure, as well as, having or easily sleeping events where, sometimes when you're driving, you can fall asleep, which
Right.
is a problem.
So looking ahead 5 to 10 years, what role can healthcare play in diversifying West Virginia's economy?
Well, I think that that's a really important question. And we know, at least from the last jobs report in the country, that healthcare jobs really kept the jobs positive in our country. And we know that as far as employment goes, WVU and WVU Medicine are the largest employers in the state. WVU Medicine is the single largest employer in the state. But healthcare systems like Vandalia Health and Marshall Health also employ a lot of people. So to me, healthcare is a foundation, because if you're not healthy, you can't easily get a job. And we know that we want to increase workforce participation for our population, and we want to train our population to be able to get good jobs. But healthcare, jobs, economy, and education, to me, are all tied up into really an interwoven quilt of sorts. And what we really want to do is we want to help improve the health of our population, and we want to improve the education rate. I mean, it's really interesting that two researchers from Princeton found that the difference in lifespan between somebody who graduates from a four-year degree in college versus a high school degree is 8.5 years. And if you graduate with a 4-year college degree versus no high school degree, it's an 11-year lifespan difference. And I don't think it means that just because you don't have a college degree that you somehow don't live very long. But I think it's the things that help us be healthy, the things that help us live a long time, as we said, are the things that we get fulfillment with from our work, which is other people, our community, our friends, our social networks, the value that we have, how we feel about ourselves, the purpose we have, the reason why we get up in the morning, and how we see the world. And all those things, I think, are really important to help our workforce be very productive and help our state and our state's economy and population continue to grow, and to be able to reinvest back again in our people, as I know that you have championed and really are leading for our state. We appreciate that.
Well, the next time we do this, and we'll do a follow-up,
Yes.
we won't be sitting in chairs. You and I'll go for a walking interview, and
Love that.
we'll keep moving. Thank you for joining us for Just Three Questions. Thank you very much for watching, and we'll see you next time.